In an emergency, access to blood can make the difference between life and death.
And for patients losing too much blood, their risk of dying increases with every minute they do not receive a transfusion. In most cases, a transfusion doesn't take place until patients are at the hospital. However, numerous medical studies have shown that giving whole blood before a patient arrives at the emergency room improves their odds. But not many ambulances carry blood.
Reporter Kristen Crowley looks into the use of what's called pre-hospital blood, plus the barriers preventing more EMS agencies from using it.
I had to fight for them. I had to fight for my family.
Kelly Moore fought for every second she now spends with her son, Easton. But in 2023, time became this Tennessee mom's enemy.
No warning at all.
For reasons she says her doctors still don't understand, Kelly delivered Easton prematurely on the floor of her parents' bathroom. When paramedics arrived, Kelly was drifting in and out of consciousness and losing a lot of blood.
I fought every breath that I had left.
Kelly was uncontrollably bleeding or hemorrhaging, which is responsible for more than 60,000 deaths in the United States every year. The EMS team who responded knew Kelly was at risk of bleeding out and said they needed to act quickly.
We never give the product unless it's life-threatening.
That product is whole blood, and it's what saved Kelly's life.
There's the red blood cells and the plasma.
Whole blood is simply blood that flows through your veins. It contains red cells, white cells, and platelets. The Cleveland Clinic describes platelets as the body's natural bandage. They originate in bone marrow, and their primary function is to prevent and stop bleeding. Kelly was lucky. She happened to live where ambulances carry whole blood, but most rescue agencies don't have the resources. According to a June 2024 article in the Journal of Emergency Medical Services, the number of EMS agencies in the U.S. transfusing pre-hospital blood is 156 and counting.
The patients that we'd give it to the most would be like the patient with traumatic injuries, so whether that's a severe motor vehicle crash, a shooting.
In the fall of 2023, Christiansburg EMS became the first EMS whole blood provider in Southwest Virginia. Christiansburg Deputy Rescue Chief Dustin Williams explains how a blood transfusion in the field works.
It comes cold, has to stay less than 10 degrees Celsius, and once we would give it, of course, we get it, and it actually goes through a warmer that it warms to room temperature and warmer as it enters into the patient.
When we're talking about pre-hospital blood, there are some real challenges.
Diane Kalmus is the Vice President of Government Affairs with America's Blood Centers. She says there are several factors involved in implementing a pre-hospital blood program, and one of the biggest roadblocks is cost.
This goes back to a lot of places copy what Medicare does in terms of how they pay for various services. The reality is that base rate just simply doesn't cover the cost of having pre-hospital blood.
Medicare, Medicaid, and private insurance currently don't pay for blood until patients get inside the hospital. But according to a CMS spokesperson, Medicare is considering expanding its coverage to include medically necessary whole blood transfusions in the field. A decision about Medicaid coverage would have to come at the state level. Back in Tennessee, Kelly is now recovered, and doctors say she will have years to spend with her son thanks to the life-saving blood transfusion she received in the back of an ambulance.
In every case, if we can get there quick enough, it certainly is the difference between life and death.
According to the Journal for Emergency Medical Services, the idea of carrying whole blood on board an ambulance stems from studies performed on the battlefield. Soldiers who were deployed in Iraq and Afghanistan were 20 times more likely to survive in trauma cases if they received blood within 34 minutes of injury.